is wealth. Vital is vital. You gotta take care of yourself.
Hello, do you want to live your best? You want to live your way into a healthy and beautiful body, free from all forms of diseases such as diabetes, high blood pressure, cancer, hemorrhoid, and so on? Are you limited to particular food intake due to your health status? Oh yeah, I bring to you good news. As you can eat what you want, contact us today for any of these services. Holistic nutrition consulting based on individual health status such as diabetes, high cholesterol, high blood pressure, among others. Visit us in our office at 10039 Bisonet Street, Suite 228D, Houston, Texas, with zip code 77036. You can as well book an appointment with us on our website www.begandbomservices.com or call 347-61 35485 347-61 35485. As B&B, your health matters to us.
Health is wealth. Vital is vital. You gotta take care of yourself.
Hello, everyone. Welcome back to the show, viewers. Today on the show, we continue our advocacy for cancer preventions. And the next cancer we will be educating on today is skin cancer. Yes, skin cancer is one of the preventable cancers we've been educating on for the past 4 weeks now. Just to recap, we've talked about cervical cancer, breast cancer, pancreatic cancer, and of course, an aggressive prostate cancer. So today, let's talk about skin cancer. And why the skin cancer is very important is because skin is the largest external organ of human's body. So it is very important we pay more attention to our skin than any other in our body. So welcome back to Healthy Living with Bofa Talk Show. I'm Dr. Betty. Let's take a quick break. I'll be right back. Welcome back, viewers, and thank you for joining us today. Like I said before the break, our focus today is on skin cancer. And the reason why is it is the type of organ we must pay attention to because it protects all other organs in our body system. So we're going to be talking about skin cancer today, how to prevent it, those factors that can cause cancer. We want to talk about it so that we put more preventive measures in place. Skin cancer is one of the common preventable cancers one can think of, and it's apparently the abnormal growth of the skin cells. What that means is skin cancer is when your skin cell begins to grow abnormally. Yes, and it normally develops on skin exposed to the sun. But this common form of cancer can also occur on areas of your skin not ordinarily exposed to sunlight. So it doesn't necessarily mean that it must be the one that exposed to the sunlight. And we have 3 major types of skin cancer. Yes. We have basal cell carcinoma, we have squamous cell carcinoma, and we have melanoma. These are the 3 major forms of skin cancer. And like I said earlier, we must try our best to protect this organ so that it doesn't affect every other organ in our body. Skin protects every other organ. This is the reason why we must pay more attention to it. So let's talk about skin cancer today. Skin cancer is one of the common preventable cancers. Yes, and we must have it in our mind that this skin must be protected. Yes, must be guided jealously. You don't want anything to happen to your skin. Now, where does skin cancer develop? Where on or in the skin does cancer grow? Like I said earlier, that skin cancer develops primarily on areas of sun-exposed skin and also on areas not ordinarily exposed to sunlight. These areas include the scalp, face, lips, ears, neck, chest, palms, beneath your fingernails or toenails, and your genital area that rarely receive sunlight. These are the areas that you can find this type of 3 cancers. Now, let's take a look at it one after the other. I mean, the types of cancer. And I'll start with melanoma. Why melanoma? I start with melanoma because I often say to people that there is no part of the body that cannot be attacked by this disease called cancer. I mean, any part of human body can develop cancer as long as there is a cell in that part of the body. Obviously, we all know that all human beings' bodies have cells. So cancer can grow in those areas, in any part of our body, including our skin, which is the largest external organ of human's body. Now, let me start with melanoma. Melanoma can develop anywhere on your skin, on your body, in otherwise normal skin, or in an existing mole that becomes cancerous. And where do you see melanoma? In the skin. It most often appears on the face or the trunk of affected men. In women, this type of cancer most often develop on the lower legs. So anytime you see cancer growing in the legs, it is also melanoma cancer. In both men and women, this type of skin cancer called melanoma can grow on the skin that hasn't been exposed to the sun. And it can also affect people of any skin tone, which means it can affect the dark skin, it can affect the light skin or chocolate, whatever skin tone you have. This type of cancer can grow in any part of your skin. In people with darker skin tones, melanoma tends to occur on the palms and soles or under the fingernails. When I tell people that cancer can grow in your fingernail, in your eyelid, in your toenails, people look at me like, excuse me, that tiny, organ. Yes, it may be tiny, but yet it carries cells that can grow cancer. And I've said it multiple times that cancer grows in any part of the body. Why? Because all human beings carry cancer cells. So how this cancer develops, how it grows in our body depends on what we eat, what we treat our body with. And that's the most horrible factors that grows cancer in our body. And that is why I said we must pay more attention to our skin. Why? Because our skin is the largest organ in our body that protects every other organ in human's body. So basically, if you are a man, woman with darker skin tones, cancer can grow in your palms. It can grow in your sole, under the fingernails or your toenails. So this has nothing to do with sex. It has nothing to do with age. It has nothing to do with color. Now, who is at risk for melanoma cancer? Who can develop this skin cancer? Like I said earlier, there must be factors that will make this cancer grow in your body. Who are those people that are at risk of this melanoma cancer? You will be surprised if I say that everyone is at some risk for melanoma. You know why? Because we are all exposed to sunlight. We must receive sunlight, no matter what. It may be little, it may be more, but our body needs sunlight. Well, because we need vitamin D, of course. Yes. An exposure to sun gives us both UVA and UVB rays. And these are very dangerous to the skin. Yes, when I say it's dangerous, ultraviolet is dangerous to the skin. I've said it multiple times on this platform. And this can induce skin cancer. Ultraviolet can induce skin cancer, including melanoma cancer. Yes. Other factors are numbers of moles on the skin, skin type, and family history, that is genetics. Now, when it comes to blistering sunburn in early childhood, especially increased risk, this can cause a skin cancer as well. If you have blistering sunburn, that can expose you to skin cancer. So that is why we always tell people that you need to stay in the sun between 18 to 20 minutes every day to receive your vitamin D. If that is the reason why you want to stay in the sun, of course, that's basically the reason why we want to stay in the sun, to get our vitamin D. But when you are taking too much, when you are staying too long in the sun, that's when you begin to have too much of ultraviolet rays. And that is very dangerous to your skin, and it can cause melanoma cancer. The next cancer is called squamous cell carcinoma. Yes. Most often, this type of cancer cell occurs on sun-exposed area of your body as well, such as your face, your ears, and your hands. If you see cancer coming out of your ears, your hands, that is squamous cell carcinoma cancer. So people with darker skin also are more likely to develop this cancer on areas that are not often exposed to sun. Like I said, it doesn't have to be people that are exposed to sunlight. If you are not exposed to sunlight, such as your genital area, you can also develop this skin cancer we're talking about. So now, for the squamous cell carcinoma, who are at risk? Who are these people that can develop this type of cancer? People who use indoor tanning beds have an increased risk of this cancer. What does that mean? Some people want to tan their body. They feel like they are too white. The color is too flashy. They're too, and basically they want to tan their body. They want to look like African skin type. So they begin to tan their body. They expose their body on the bed to some lights in their room. Some go to the beach and stay in the sun naked and want to tan their body. These can also cause cancer. And that particular cancer is called squamous cell carcinoma. So if you have any skin cell that grows in your body, your skin, and it is diagnosed to be squamous cell cancer, that means you are at risk because you are using this light to tan your body. And when you go to the beach or you go out there, you stay too long in the sun to tan your body, this is what you get. So people that do all this are at risk of this type of cancer. Now, we have less common skin cancers. These are Kaposi sarcoma. What is Kaposi sarcoma? This type of skin cancer is very, very rare. It's not common. And it develops in the skin blood vessels and causes red or purple patches on the skin or mucous membranes. So that is why it is not common. It's in the blood vessels. We just have to be very, very careful of what we do to this skin because you don't know what gets into your skin and go down to your blood. Because every part of your body, your skin, the blood flows there. And if you're having problem with the blood vessel through your skin, that is a big problem. When it comes to apostle carcinoma, it's mainly occurred in people with weakened immune systems, such as people with AIDS, HIV, and in people taking medication that suppress their natural immunity. Yes, such as people who have undergone, organ transplants. These people will have weakened immune system. If you are the type that have gone through, transplants or kidney change or whatever change, definitely you have weakened immune system, either through medication or through, therapy or everything. You will have weakened immune system. Of course, if you have HIV, definitely you don't have a strong immune system in your body. Now, when it comes to Kaposo sarcoma, who are at risk? People who have HIV/AIDS, of course, you are at risk. People taking immunosuppressant medication, they are at risk. If your immunes are so low and you are taking medication, or you have problems that need to that affect your immune system, that depresses your immune system, you are placed on medication, you are at risk. When I say the cancer can develop in your eyelid, people say, oh, how come is that? Now I'm telling you, the cancer can grow, and that cancer is called sebaceous gland carcinoma that grows in your eyelid right here. You can grow cancer anywhere in any part of your body, where they are frequently mistaken for other eyelid problems. If you have this thing going on and you're thinking is just boil, some people will have problem with the eyes. They will see the boil, the abscess in the eyelid. They will be putting red oil. They will be putting shea butter. They will be putting a lot of things just to bring the boil down, not knowing that it's a cancer. Instead of them to go to the doctor immediately and get tested, do the x-ray and see if that is actually ordinary boil, they will not do that. They will wait until that thing become bigger and something you cannot treat anymore. Stage 1, stage 2, stage 3, you'll be looking at it until you get to the worst stage that is not treatable. And that is the reason why we are making noise right now. We are advocating that any signs, anything unusual things that grow in your skin, you quickly rush to the doctor and get tested. Anything at all, be it mold, be it boil, rashes, any unusual thing that you see between 1 or 2 days and refuse to disappear on your skin, go and get tested for that to be sure that this is not cancer. This is not something that can take life. You need to pay attention to this information because it can happen to anybody, anytime. And that's the reason why preventive measure is very important here. If you take precaution, if you take prevention right now, you won't be in that history of that generics problem. Yes, you've heard it that this can cause cancer and this is what you should do to prevent it, either to eat it or to be careful of doing this or using this or applying this. You do the same thing and you will see that you are not at risk. You will see that you will not have problem with this cancer. But in inability to prevent and take precaution, to take preventive measure, that's when you write your name on that list of that your family history of cancer problem. So now let's talk about the causes of skin cancer. Number 1 is unprotected or excessive UV exposure from the sun or indoor tanning. If you go in the sun without sunscreen or taking too long in the sun. That means you get excessive one. And if you are not using sunscreen, that means you don't protect your skin. Definitely you'll be exposed. Or those of you that tan, you do indoor tanning. So this is one of the reasons why you can develop cancer. You need to avoid that. Avoid too much of sunlight and protect your skin. Even at all you want to go to the sun, put your sunscreen on. Some people are in the sun for 24 hours because of their depth of the business they do. Those hawkers, they will be in the sun hawking, going from one customer to another. You will definitely be exposed to the sunlight. So what you need to do there is you protect your skin by using the sunscreen. That's the only way you can do it. Of course, you have to eat, you have to make money, you have to do this to help yourself. And this is done in the sun. But the only way you can protect yourself from this UV exposure to sunlight is you apply sunscreen. That's the only way out. Next one is weakened immune system due to a medical condition, medications, or other cancer of HIV/AIDS. Yes, if you have weakened immune system, you are likely to develop this type of skin cancer. If your immune is weak due to whether you have taken some medication or you have a medical condition the existing condition, or you have cancer in the past. It could be any cancer. It doesn't have to be skin cancer. It could be lung cancer. It could be breast cancer. You are at risk for this skin cancer. Or you have HIV or AIDS. You are at risk of this skin cancer because your immune is weak. Next is many moles. The more moles you have on your body, the higher your risk for melanoma. If you have too much of moles on your body, it can expose you to this cancer. So that is why you need to take care of your skin and protect it every time regularly. It is very important. If anything happens to your skin, it happens to every other organ in your body. That's the fact I want you to understand today. Next is fair skin. People with fair skin, light eyes and light or red hair are at risk. Skin cancer history. If you have had it in the past, people who have already had melanoma before or any type of cancer, you are at risk. Yes, you run a greater risk of developing melanoma in the future. Generics, I've said it before. I'm not going to talk about it because it's not something I want to talk about because I don't believe in it. If melanoma runs in the family, you can have it. If you don't prevent yourself from this, then you fall into that generics problem. I don't want to talk about it, but generics can cause, skin cancer. Organ transplant medications can also cause it. If you have had organ transplant and you're being placed on of course, when you have surgery, they will give you medication. Most expensive surgery in life. When you transplant any other, like a kidney, like heart, like lungs, all those type of transplant, if you had it in the past, you will definitely be given the medication to recover. So this can expose you to skin cancer as well. And lastly, immune system suppresses medications for arthritis or psoriasis. If you have immune system that suppresses medication due to that arthritis or psoriasis, it can expose you to skin cancer. Yes. Now, when do you see a doctor? If you experience all these signs and symptoms, you see that, okay, you feel like you have history of cancer, or you see moles in your skin, or you realize that you have a sunburn You begin to see your body's, turning red, all those unusual, signs in your body. What do you do? When do you see a doctor? I always tell people that every human being must do annual checkup for every organ in your body. And that includes cancer screening. So this, I'm going to tell you that annually, you must check your skin to see that you are not at risk of skin cancer. And if you notice any changes to your skin that worries you, it could be a week, a month, or months after your annual checkup. What I mean by that is, if you do your annual checkup today and a week later, a month later, or months later, you begin to see unusual things coming up of your skin, you need to see your doctor immediately. Don't wait till another day of your checkup. You can't do that. You need to see your doctor as soon as possible. And I want you to know this. Not all skin changes are caused by skin cancer. But when you see your doctor, if you discover any changes in your body, when you see your doctor will be able to investigate your skin changes to determine the cause. Whether it is skin cancer or it's another health problem, if you don't see your doctor, this is impossible. This cannot be revealed. It cannot be determined by your doctor. That is why you need to see your doctor for better advice, possibly the treatment. Now, how do you prevent it? If you want to avoid this, you don't want it to happen at all, what do you do? What are the preventions to skin cancer? Of course, since the common cause of skin cancer is exposure to ultraviolet radiation, because of this, you can reduce your risk of skin cancer by limiting or avoiding exposure to ultraviolet radiation from sunlight. Because most of the causes we've been talking about, each skin cancer is always sunlight, sunlight, sunlight. So the common cause of skin cancer is exposure to UV, ultraviolet radiation. So you want to make sure you reduce the risk by either limiting or avoiding exposure to that UV radiation from sunlight. You want to use sunscreen with minimal SPF 15 while you are out in the sun. I've said it earlier. You want to protect your skin from direct UV by wearing hats, sunglasses, full gloves to cover hands and legs if you need to. These are the ways you can avoid or prevent yourself from this UV radiation that can cause your skin to be, attacked by this skin cancer. Next, you want to do is early detection of skin cancer gives you the greatest chance for successful skin cancer treatment. So, you want to check your skin for suspicious changes to help detect skin cancer at its earlier stage. Yes, this is very important. If you don't check yourself, there's no way you will see or you will know that there's a problem with that organ. So you need to take early detection screening. And lastly, you want to keep an eye on any abnormal moles or warts on your skin. If you see anything on your skin, unusual moles or warts, you want to quickly do a screening on that. Check it out to see if you are not at risk of it. It is not cancer growing there. Thank you for joining us today on Buffet Talk Show. I'm Dr. Betty.